At 48 years old, Kat underwent a facelift.
My facelift update. I'm 48 years old.
There are many patients in their late 30s, early 40s who are considering changes like this one here.
So there's a big trend happening in plastic surgery, and I was recently featured in Elle magazine to discuss this very topic, which is facelifts in people in their 30s and 40s. Now, this is something we've certainly discussed with lots and lots of my patients in consultation, and today we're going to bring that topic to you. Are we seeing more people jumping into surgery and skipping fillers and lasers and all these other things? And is that a good thing? Is that a good trend? Or are people just rushing and jumping the gun on this topic? Just because there may be more and more people asking for surgery at a younger age doesn't mean that they are necessarily candidates. The purpose of this video is to not only discuss the topic, but ultimately give clarity over who is actually a candidate for a surgical facelift. So if you're in your 30s and 40s watching this, great, you're gonna have clarity. But if you're in your 50s and 60s, it's gonna give you a lot of opportunity to understand for yourself if you are indeed a candidate for surgery. So make sure you stay tuned and watch this thing through, because there's gonna be some very important nuggets and even a new paradigm associated with candidacy for surgery, especially if you're on the younger age spectrum. And for those of you who don't know me, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of KaramMD Skin. And I want to just establish a little authority on this topic. We receive roughly 10,000 surgical inquiries each month. So if there is a trend, we're going to be able to see it based on those numbers. I've been in practice for 20 years, so I have some longitudinal experience how things were and what things are today. So I'm going to share that with you. Without further ado, let's break this topic down and really start understanding it. So number one question, is this really a trend? Yes, it is a trend. What we have seen in the last 20 years of my own practice is that younger patients are having surgery. In the early days of my practice 20 years ago, the average age was somewhere in their late 50s and early 60s. Today, the average age for a qualified surgical candidate is more like late 40s, early 50s. It seems to correlate very precisely with perimenopause and menopause as sort of the on switch that causes the face to show signs of laxity and shape change. Now, the signs of aging that people typically want to have surgery for is jowls and neck laxity and heaviness of the face, etc. The look and shape of the face begins to change. Now, people were living with it much longer before. They are now saying, you know what, I want to get in front of it. I don't want to live my entire 50s looking this way and getting more and more aged. I want to address it. Across the nation, every colleague I speak to, this is definitely a trend that we're seeing. We're also beginning to see people in their 30s and 40s inquiring at greater percentages. By the way, just to be clear, when I talk about 40-something, I'm talking about early 40s, not late 40s, because late 40s is kind of an appropriate time for a facelift no matter what. But typically somebody in their late 30s and early 40s doesn't really need a facelift by the standards that I just mentioned here. In our practice, we get roughly 10,000 inquiries each month from people who want to have surgery. Now, I asked my coordinators to break this down for me and give me a little bit of an idea. About a third of the inquiries coming through are people in that age group now. Didn't used to be this way. But then when you sift through and look at the photos and evaluate them, there's only about 5% of them that are actual surgical candidates. So yes, there is an increase in demand. More and more people want to have it done at earlier ages. They're skipping and wanting to skip the non-surgical treatments, etc. But it still doesn't mean that they're candidates, at least from the criteria that I use for candidacy. So what are some of the driving factors that might be causing this? There's a significant awareness and realization that non-surgical treatments don't treat laxity. So things like threads and RF treatments like Morpheus and fillers, etc., they're not getting the job done when it comes to treatment of laxity. In fact, that long term, there's some more trouble associated with it. And I've done various videos discussing some of the consequences of these type of treatments, and people are catching on. More women are wanting to get in front of aging. They want to basically prevent. So this preventative notion is a bigger concept than it ever has been. I mean, it's logical, right? I mean, if you can do the same procedure a little bit earlier in your age range, as opposed to living with some change, some jowls and neck laxity for 10 years, well, why not do that? Get in front of it and prevent it from ever even getting to that point. And I actually find that to be a very good reason to do it in the right candidate, because enjoy your youth and beauty as long as you possibly can. There's another aspect, which is social media. Social media has really given a stage for surgeons like myself who do very natural, beautiful, elegant, non-operated looking surgeries. So as a result, when you look at these before and afters, it's compelling. You're like, okay, well, what's the downside? If I can look youthful and beautiful and not look like I've had surgery done and look totally normal and natural, I'm gonna have surgery. So there's been an explosion of awareness that surgery doesn't have to mean that you look pulled and tight and all that kind of stuff. So that aspect is giving people a lot of inspiration to wanting to go forward with surgery. And I think ultimately there's another aspect to this is, can having surgery earlier in the aging spectrum slow down future aging? And this is definitely something that is true, because once you get in there, assuming you're doing a proper type of a surgery, and I'm going to discuss what proper surgery means towards the end of the video, but assuming you're getting a good, solid, high quality lift, like a deep plane, vertical restore, something that is actually, addressing the tissues at that level, your entire future aging is going to be altered in a favorable way, which means, and what you actually can envision is that every year that goes by, you are still aging, but aging much slower than you would have aged if you hadn't had the surgery. So what ends up happening is somebody, say in their 50s or late 40s, get a surgery done and never get another one done for the rest of their life. They're always gonna look about a decade or so younger at every stage of the rest of their life. So it's a powerful and very compelling concept that if you have high quality lift can slow down facial aging. And that's a big motivation for a lot of people. So when you take all of that together, you really can understand why there is a demand and a desire for people to want to get this done sooner, as opposed to messing around with things that either aren't going to help them or ultimately let them just age unopposed and live with the aging changes that they so desperately don't want to see in themselves. Because ultimately, looking as young as you feel is really what this is about. So what am I seeing in my practice, and when did this all start? I would say for most surgeons and most practices in the country, we all saw a very significant spike in facelift demand during and after the COVID pandemic. I attribute it to a number of things. Number one, social media kind of blew up during that time. Surgeons spent more time creating and showing before and afters. I know I certainly did. And so many other people were working from home and had a lot of time on their hands. So there was this sort of a perfect storm of exposure in combination with awareness, and that led to a big demand in facelift surgeries. And we've seen that across the globe. And ultimately, I think what you're gonna capture here is that I'm big about candidacy. Just because something has a demand and there's an opportunity for a surgeon doesn't mean a surgeon should say yes to everyone who inquires. So this is where your empowerment ultimately needs to be in your favor and basically keeping you in front of this decision-making process so that you don't go down wrong avenues and wrong roads and regret some of these things. And I think some of the stuff I'm about to share is really gonna help you with that. Now, if you haven't already, make sure you subscribe to this channel, because this type of information, this personal empowerment, is really what this channel is all about. Let's ask this question. Is this a good trend? Should younger and younger people be getting facelifts? Not necessarily, and I'll tell you from my own experiences. If you do something too soon on the aging continuum, what's there to show for it? Think about this for a second. If you've got just the earliest, smallest signs of aging, a little bit of laxity around your nasolabial fold, a little bit of laxity in your jawline, and you jump to go do the surgery, you go through the downtime, you go through all this other stuff, the healing, potential complications, etc., and then you look back at your before and afters and there's hardly a change. I'm telling you, from my own experience, it's not the most rewarding thing for both the surgeon and for the patient. The only thing that could potentially be rewarding in that scenario is that you have to almost anticipate what you would have looked like 3 years from now, 5 years from now, 10 years from now, but there's no way to really show that, right? So what ends up happening is you go through this, the expense, the downtime, etc., and then you look back and you say, was that really a great decision for me? I mean, I hardly look any different. Doc, did you even do anything for me? I have personally become much more conservative and actually outlined a very clear path to who's a candidate, etc. And I don't operate on patients in their 30s and or even early 40s very often at all, unless there's good reason. So let's get into that. So who is actually a candidate, and how do you know when you're ready? So this is something I've spent a lot of time thinking about. And what I've come to conclude is whether you're in your 30s, 40s, or 50s, the same criteria should be applied. What that criteria has boiled down to me is this notion of aging momentum. And what aging momentum means is that it's not just the presence of a little bit of laxity and therefore you gotta jump the gun and go after it. Because that little bit of laxity can sit there looking exactly the same for years before it becomes more laxity. And that's the whole point, is where are you in the aging continuum? Are you in a place where you're starting to see momentum? Aging as a process should be getting worse and worse and worse. And what we typically see for people who are in their late 40s and early 50s who come in and want to get something done, they're starting to see their face change very rapidly. I mean, my wife, for example, by the time she was starting to see the laxity happen in her 51 to 52 range, it started happening very quickly. Like 6 months went by and there was a lot more laxity than there was 6 months before, in the 3 years before that, right? So everything kind of stayed the same and then it started happening. Well, if you see that in a 30-something-year-old, late 30s and early 40s, that indicates there's premature aging happening. Premature aging means it's the same aging process that would affect a 50-year-old as it's happening now to somebody in their early 40s or late 30s. And therefore, that person is just as much of a right to get in front of it and prevent it from getting worse and enjoying their youth and beauty and looking as young as they feel as somebody who's older. So age by itself, that chronological age, is not a criteria, but it's the degree and the fluidity of aging, the momentum of aging. If I see that, if I see somebody who's got, significant levels of jowling and neck laxity, et cetera, at that age, my heart goes to them and I actually want to help them. And I ask them the questions like, how long have you noticed this? Oh, the last year or two, things have really started to unravel. I feel like my face is falling, da 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 da. There you go. That's important information. Now, if they say, Doc, I've got this little bit of laxity, I don't feel as pretty as I did when, 5 years ago or 2 years ago, and I just want this to be tucked up. Well, has it changed? Not really. It's been about the same. I'm not operating on them. They're just not, because of the reasons I just explained in my cautionary rant up there. What ultimately we want to see is momentum. That is what aging is. Aging is a progressive change, and what this type of surgery is to restore it, but also prevent it from going further. So this information you can apply to yourself at any age. Ultimately, what do you do? This is a question we get asked all the time. What do you do if you start to see a little bit of laxity, but it's not progressing, you're not a candidate for surgery? What should you do when you're in your late 30s or early 40s? The answer is nothing. Frankly, nothing. You don't need to do surgery. You don't need to do anything major for that particular problem because the target isn't ready for you yet. However, there are things that you should be doing at that age and at any age to address different aspects of aging that is going to come into play for the rest of your life. And number one is skin. Skin is a huge part of looking as young as you feel, because when you think about what a 20-year-old looks like, they have young looking skin and they have a young looking facial shape. So if you someday want to get a facelift but you have aged looking skin, fine lines and wrinkles, discoloration, dryness, crepiness, etc., you're not going to look nearly as youthful as you would if you started that process with beautiful, youthful looking skin. And this is why I've always been highly, highly, highly dedicated to managing skin as a part of the surgical practice. What that means for you is, if you're listening and wondering what you should start is, well, number one, you gotta be on a comprehensive skincare routine. That's a big part. The trifecta is probably the most comprehensive and the most simple to apply. It has all those important actives that I've spent a lot of time in the past talking about, but you need these set of actives to basically resist and restore skin from aging. Number two, you gotta be all over your sun protection. That's huge, right? So you got those two pieces dialed. Once you've got that aspect going, just kind of relax and sit back. Beyond doing a little bit of Botox and things like that, you don't need to do a whole lot at that stage. You will know when the time is right for more based on the criteria I just gave. So once you've got your sun protection and skincare and potentially Botox dialed in, and that becomes your routine, daily routine, and that's your lifestyle. Now, there are some things that are happening to the people who are in their late 30s and early 40s that do require a little bit of intervention and are appropriate. Number one, volume loss affects this age group. Volume loss is where you begin to lose fat pads in your temples, around your eyes, upper eyes, lower eyes, your lips lose a little volume, down around the jawline area. They call this a prejowl sulcus, loses a little bit of volume. Great target for fat transfer. In fact, that's exactly what I did with my wife when she was 36. I did a fat transfer on her up until 52, beyond skincare and Botox, literally did not do another thing. So she had almost 20 years where basically maintenance free. And she felt great too, because she got her volume back that she lost, from pregnancies and just premature volume loss, and we replace it. You can do this with fat transfer if you find a really, really good, natural-looking fat transfer surgeon that can produce great results. I don't do that anymore. I used to do a ton of it. I'm so busy doing vertical restores, which I apply the fat transfer to, but I don't have space in my schedule to do fat transfers, but there are surgeons out there that do that. In addition to that, there's also changes that are happening to your eyelids. A lot of people in their early 40s and late 30s start to get hooding of the upper lids and lower lids, and doing blepharoplasty is perfectly appropriate for that age group. Now, a facelift might not be, but those are very, very appropriate procedures. In fact, what we find when a third of the nearly 10,000 inquiries we get each month for facelifts, majority of them are candidates for eyelids and fat transfer. And if I did those procedures, they would be more than happy to start with that and wait for the other piece. But you can certainly find doctors and surgeons who can do that for you. And if you can't find a fat transfer surgeon and you decide to go down the filler route, listen, I speak sort of poorly about fillers because so often people are overdoing it. They're overfilling it. They're ballooning out the cheeks and jawlines and all this other stuff. If you do it in a very subtle and a very gentle way, a little bit in the temples, a little bit under the eyes, a little bit along this area, you can restore your volume nicely with filler, but you really don't need to do it every 6 to 9 months. I mean, it should be like once every couple years, you're going in there and doing this in just tiny little bits, and then you're buying yourself a bit more time, and then ultimately you get a fat transfer and a lift, and then you're kind of good to go for decades after that, right? That's the game you can play. So it's not an all or nothing with the filler, and it's like I said, it's hard to find good fat transfer surgeons, but if you find one, that's a great procedure to start with. If you can't, fillers are totally appropriate if they're done the way I described it, in a very gentle and very minimalistic kind of a way. So here are some final thoughts on the subject. Facelift surgery is the only true treatment for laxity. There are appropriate candidates who are in their late 30s and early 40s, and if you happen to be one of them, please give me a call. Please look into it. I'm happy to help you. I'm going to share a story of a patient of mine who is a perfect example of where this applies and how it can literally be so freeing for that entire post-surgical period. So her name is Melody. She's a neonatal ICU nurse, and she had the beginning of laxity starting to progress. Her jawline started to sag a bit. She got hollows and bags under her eyes. Beautiful, beautiful woman. Just started seeing the early signs of aging. And it was a continuum. It started to happen and started to progress. She's super fit and super active. She wanted to continue looking this way. So she called me and we evaluated her and ultimately decided she would be a candidate at that time for a vertical prevent because she didn't have any laxity in her neck. So instead of a restore, I did a prevent, did a fat transfer, and did a lower blepharoplasty. We still keep in touch. Every few years, she sends me some updated photos, some beautiful texts about how amazing she feels, how beautiful she feels, how youthful she feels, and how this was the absolute best decision she's ever made. And it's been an incredible decade of feeling self-confident and beautiful. And really, her entire aging has been altered. Wonderful, wonderful candidate. Perfect sort of solution for that type of a person. That's where the sweet spot is. That's who you want to basically be to operate in these kind of conditions. And that's why I want to put my thoughts in this particular video so I can help you guys decide. And here's the final thought on this. So this question comes up all the time. Okay, I've got a little bit of laxity. You do this big operation, the vertical restore, which is really a big operation, right? I mean, compared to a mini lift, it's like the entire other extreme. However, what do I think about mini lifts? I did a whole video talking about one of the things I disliked was mini lifts and why. Because if you're late 30s, early 40s, and you're on the aging continuum and things are changing on you, the last thing you want to do is have a minor procedure like a mini lift, come back 2-3 years later and look exactly the same. You've got the scars to show for it. You went through the downtime. You did all these other things, and you're basically nowhere further on the continuum. You're basically back to square one very early. And plus, there's a lot of complications that happen when things aren't properly secured. Ears get displaced, scars get widened, all these other things that we see with mini lifts that I'm personally not a fan of at all, especially for the younger person, because especially for that younger person, you're trying to change your aging trajectory for the rest of your life. You already have bad genetics, meaning that you're already starting to age about a decade earlier than everyone else was. The last thing you want to do is basically do something and then be back to square one so soon. That's why mini lifts, I would say stay far, far away from. When the time comes, do it the right way. Do a deep plane, do a vertical restore or vertical prevent, whichever one. That is how you're going to get freedom from needing to do things over and over again. So mini lifts are a big no-no. All right, folks, if you're wondering if you're a candidate and have some questions about it, drop them in the comments below. If you enjoyed this video, learned something, hit a like and share this with your friends and family. And if you have any other ideas about great video topics, also drop them in the comments below. Anything else you'd like to learn more about, this is what I'm here for. I'm here to educate and help you navigate through this process. And if you haven't already, make sure you subscribe to this channel and follow my newsletter as well, the KaramMD Journal. It's a free newsletter sent to your inbox so you get good information. All right, folks, until next time, Dr. Amir Karam, so happy to be a part of this journey with you all and privileged to be able to share my thoughts. Thank you so much.